There are 1.5 million people with a learning disability in the UK. 351,000 are children aged 0 to 17. People with a learning disability die more than 20 years younger than people without a learning disability. A man with a learning disability dies 22 years younger, and a woman, it is 26 years difference. We have just learned from the Race Equality Report that people with learning disabilities who are from Black, Asian, mixed ethnicity, this increases to a staggering 34-year difference. This is because people with a learning disability and autistic people face inequalities in their healthcare. They are given information that is not clear to understand, not able to access buildings, and capacity is questioned regularly. We need to get better at supporting people to be part of their own healthcare and decision making.
One of the most important things was making sure that people were as healthy as they could be. So helping them with their healthcare, doing things like going to the doctor's appointments, helping people to talk to doctors and nurses about what reasonable adjustments they might need. Always just wanting to make sure that people got what they needed, whether that was healthcare or maybe getting into a job or maybe getting their own place to live.
So if it was like me, for an example,
Yes.
like going to a GP, like I've been to this morning, I'm a very nervous patient, and like I'll sit next to the doctor. I ain't got an issue with that.
I'd talk to you first and find out if there was anything that we could do to make that a bit easier for you.
If that was mean to you, it would just be you, like obviously what you just said, not meeting me at my doctor's.
But I think it's also important for you to be able to tell the doctor what you need. So sometimes it's nice to have a conversation with a doctor or a nurse before you've even got to go. So when you were in hospital and you had your procedure, did they make some changes for you? They did, that's good. What changes did they make?
The time of the appointment.
The time of the appointment, right? And did they give you more time, did you say?
Yeah.
And anything else that you were able to take in with you?
Restless.
You restless, brilliant, brilliant. And anything else that you asked for?
S Club 7.
S Club 7, mate.
Yeah.
So they played music the whole time?
Yeah.
And she was there to offer you more help.
Yeah.
To make the procedure more understanding for you.
Yeah, understanding.
Make you more at ease.
Yeah,
make you feel comfortable.
Yeah, comfortable,
And she gave you some easy read information for back at home.
So we help people with a learning disability access healthcare within the community. Just try and keep them out of hospital.
Yeah, so the aim is for everybody to access the services that you or I would access, and making sure that reasonable adjustments, etc. are done, and that we're working together as a multidisciplinary team to make that happen. Normally, what we would do is send a letter, but also do a follow-up phone call just to make sure people have had their letter, and if there's anything that we need to do to help, because a lot of these people we don't know, we've never met. So that's just to double check that we're getting all the reasonable adjustments right for that. And just to get to know us, because I think a lot of people we work with have got the white coat syndrome. They've had the most horrendous experiences. Some people that we've worked with have lived in institutions, and they've been used to not having their voice heard. They've come from a world where capacity assessments and best interest decisions were not a thing. If that person was having a blood test, they were held down and they had that blood test.
I think we look at the person holistically and address every single tiny little area of that person, so it highlights a need. And also they may feel more comfortable to speak to you, and they might not have been able to do that before with anybody else.
And they may not have been asked. It may just be the simple thing, or they've not understood if they have been asked the language,
can you tell me all about the nurses? So are the nurses good? Yes, they're good. Do they help you? They give you lots of help. Good, good. Do the learning disability nurses make you happy? Yes.
We've just heard about the great work that's going on across the Black Country and the nurses that support people with learning disabilities to access healthcare. But there's still so much more to do and more to learn, especially from when things go wrong through the LEADER programme.
So the LEADER programme is run by NHS England. It's a service improvement programme looking at health across health and social care, looking at health inequalities for people with learning disability and autistic people. It's looking at how do we address some of the issues around premature mortality within this particular group. So currently we're looking at the 3 priority areas within the Black Country. So we're looking at deaths related to cardiovascular disease and pathways relating to that, respiratory conditions and cancer, because we know within the Black Country those are the 3 leading causes of death. That's one of the key things, and I guess we are looking at kind of key priority areas within that, and part of this LEADER stakeholders event that we've got later on this year is going to be a key place to be discussing that. It's about that kind of strategic influence from a LEADER perspective. We know an awful lot about people with learning disabilities and autism and around the health inequalities that they have through this project and through the individual reviews. The bit I think that we need to really work on is how do we use our strategic influence to then take that forward within the provider organisations across health and social care, and probably wider from a partnership perspective as well, maybe into housing, maybe into sort of social employment, etc., and different elements of that bit I think we really need to understand better.
Hi, I'm Matty. I'm the co-chair of the Black Country Healthcare LDA board, and I also work for the Voice for Choice.
And I'm Cully, and I co-chair the LDA board with Matty, and I'm a director at Black Country Healthcare Foundation Trust.
So, what is the current position of learning disability services at the moment? Are we getting it right all the time?
No.
Okay.
I think it's quite a heavy task, isn't it, Matty, that we hold, because actually not only are we getting it wrong, the extent to which we're getting it wrong is quite overwhelming, isn't it? All the kind of research, all of the reports that we see, our population, our citizens are dying way too young. That's what it's telling us. So it's actually it's quite a heavy thing to hold, isn't it, that we do at the LDA board?
Yes. Lots of, when you look at the statistics, you look at the figures of how many people die and that are referred to the LEADER programme, and especially there's people from minority backgrounds who die a lot younger. It's like crazy because it shouldn't happen, and what we're doing now obviously isn't working. I mean, the board, because lots of people are involved, as in there's partners, the Voice for Choice involved, there's people from different practices, Autism West Midlands, all different individuals from different parts of the Black Country. So that gives us an advantage because it's not just one organisation. So you can get different points of views, have different conversations, and that sort of make the way forward.
Absolutely. We've got so much experience in that room, haven't we?
Exactly.
Knowledge, and when you bring all of that together, the lived experience, the kind of advocacy, the professionals across health and care, actually that breadth of knowledge, but really importantly, I think, Matty, it's that passion to make a difference, isn't it? Which is quite powerful that you've got around that table. And we've got a really kind of a great opportunity and responsibility in the LDA board to kind of use our influence and to use that position that we've got then collectively to affect change across the system to get those better outcomes for people with learning disabilities and autistic people. I think a lot part of what I think is really important here, and I think what you're saying is about how, as professionals, we take the time to really understand individuals.
Yeah.
And that individual bit is really important in this, isn't it? It's individual people and everybody's different, and how we deeply understand that and kind of personalise the support in that space and build those relationships and those connections in the way that you're saying. And I think that's a really big part of the philosophy of the way the LDA board kind of works, doesn't it, in terms of actually being, it is all about people, it is all about citizens, it's not about being up here, it's about understanding each and every person.
If you could send one message to the ICB board, what would that be?
So it would probably be, well, what are you doing? Because a lot of the people are dying. People are dying a lot younger than the general population, and nothing seems to be happening. I've been on the LDA board nearly 2 years, and from our perspective, we've seen the same things. We're not moving any further forward, and to you, the ICB, what are you doing? You really need to sort of step up your game.
Thank you.